Of a large community and where are the gaps? There's easy, sometimes some people can be marginalized in that process. And the hope here with this community survey is to make sure that we're getting a broad and active participation from the community. The community's voice is a very important part of this data collection, and we want to make sure it's part of the perspective that we're taking to make some of these recommendations. So it's something that's still being edited. Once it's finally done, the ownership will be put onto the community to make sure that we as members of it are filling it out and submitting it back to be collected. And there will be a time where we need volunteers to actually enter the data because there is not yet funding for that part of this process. So we look forward to all of you being part of that.
Okay, so you've heard about the mission, you've heard how we're going to proceed, you've heard North Shore Long Island describe what they're going to do in terms of their research and also CUNY in terms of their quantitative analysis, and also about the community survey. So we thought we now would take questions from the public. Rather than just raising your hand, maybe you can walk over here. There's a microphone because it might be just a little easier to hear people. And I'd actually like to start it off, if that's okay. We'll leave the mic here on this lectern. But Jeff, I was wondering if you had any top line statistics that you can share with us based on your preliminary research that might be interesting. I read something, just to take one anecdote, that the #1 reason for folks going to emergency rooms who are 35 years and older is because of alcohol-related incidents.
Yeah, it's interesting. We'll go through. Let me just.
They're not talking about me.
This has been in the newspaper, but it's again. That's actually an interesting way to kind of illustrate how this data is put together. And let me. I'm just trying to get to the issue on binge drinking. Just have to find this here. Okay. So it's again, no one point of information do you draw a conclusion. It's when you get multiple points, and it helps give you kind of direction and insights and magnitude. So there was a study done, I think it was in 2008, of surveys of New York community residents by the New York City Department of Health. And they asked them, how often do you engage in heavy drinking? And heavy drinking is defined an average of more than 2 drinks per day for men and women. 2 drinks a day for men and more than 1 drink a day for women. Some little bias. And basically they said, how often does that occur? You have more than 1 drink a day. And the people who are living in New York City, about 4% say, I have more than 1 drink. In Manhattan, about 7% say, I have more than 1 drink a day. In the Union Square, lower Manhattan, kind of Lower East Side part, 5% of the people say I have 1 drink a day. And in the Chelsea Greenwich Village area, 12% say I have 1 drink a day. So then we ask, what? Well, that's a good point. So then they said, okay, how about that you're a binge drinker? Tell me if you've had 5 or more drinks on one occasion in the past 30 days. New York City said 15% said, yeah, I did. In Manhattan, 19%, yeah, absolutely. Union Square, Lower Manhattan, 15%, very similar to New York City, said yes. And in Greenwich Village and Chelsea, 31% said, yeah, I had 5 or more drinks in the last 30 days. Now, you go then and you take a look at data with respect to reasons that people come and use the emergency room and are not admitted. So we call this treat and release. It's like character release. Okay, it's treat and release. You come in the emergency room, there's an acute or urgent episode, they take care of you, you're going home. And so when you take a look at those adults that are just all adults, over 18 years of age, the number one reason for alcohol is alcohol-related disorders. And for those 35 and 64, the rate in the primary service area, the dark, the dark green up here, which is most affected, is almost 50% higher than the rest of the service area. So it is, you see it from different perspectives. You see it in self-reported surveys, and then you see it in actual visits for emergency room. So folks, you got a drinking problem. And we got to talk about it.
So we need help.
You need help. And who knows why you get a drinking problem. But yeah, and those are one of the issues. But that's the kind of information. When we take a look at children, it's respiratory infections, it's virals, things you would expect. But among the elderly, particularly in the primary service area, the rate of superficial injuries and contusions and things related to back disorders and falls is significantly higher in the elderly in the primary service area than the rest of the secondary service area or Manhattan. And there are little pieces of information as we, and again, this is information I'm reading is downloadable from the website. But essentially, when you take a look at the general health status of the primary service area, with some exceptions, the mortality rates are somewhat a little higher in the Chelsea-Clinton area for diseases of the heart and cancer relative to the rest of the community. There's actually in the Lower East Side, contrary to what we've seen in New York City, and we've seen in the primary service area, that secondary service area too, their mortality rate has actually been increasing. It's one of the few communities in the city where that has been increasing. And when we look at people saying, your self-reported physical and mental health, in the Chelsea, Greenwich Village area, 9% of the people self-report that I have fair or poor health status, fair or poor. As opposed to Union Square, Lower Manhattan, where 18% report fair or poor, 13% for Manhattan, and about 20% for Long Island, not Long Island, for New York City. So what happens is the community here self-reports that their health status is relatively good. That's borne out by a lot of other statistics other than alcohol and drinking that we could talk about. Lower incidence of overweight and obesity in this area relative to the rest of the city. A higher proportion of physical activity reported. A lower use of blood cholesterol and blood pressure medicine. So there's a lot of different things, and a high percentage of people reporting that they have access to a private physician and they have health insurance relative to the other communities. Those are kind of a little just high-end kind of things that give you a sense of it. And again, not to do it, maybe in a subsequent meeting we could do a more comprehensive discussion of the findings of the study, but tonight was intended to kind of give you a kind of an overview of the process and where we're going.
And just to remind us, all of those little data points form a picture, and then what do you do with that?
Well, and
how does that advance the ball in terms of getting a full-service hospital or getting another facility that is appropriate?
Well, again, I think what we're going to be able to help do is identify and document the need based on the information. It's once you have that, it's how do you go to the next step? How do we, if you have some, I would suggest you will be very objective, validated information about the community health status. And the issue that is a burning issue, and that we're hoping the surveys will illuminate a little more than the data, Is it the availability of a hospital or the not close proximity of emergency care? And we're actually, for the next piece of the work that we're going to get, we'll be able to come back and understand a little more about that, where we're going to say, okay, after the closure of the hospital, where did the doctors go that were taking care of everybody? What hospitals are the patients using now for their care? What have been, to the degree we're able to do, some of the problems? We're not going to get that from data, 6 or 7 months later. That's where we're going to rely on some of the survey information to understand what in fact has occurred. And the data, you may not believe it, you may not like it, you may change your thinking, or it may make you intensely angry and upset. I'm not quite sure where it's going to end up, but it's put out there for the committee essentially to try to synthesize, okay, what does this mean for us and where should we be focusing, I think, our attentions?
Dr. Cohen, did you want to add?
Well, yes, what I would add is the fact that the data point to the Chelsea community being, let's say, healthier than other communities in Manhattan or New York City doesn't mean that you don't need a hospital. Right. It doesn't speak to what are the factors that contribute to having a healthier community here than there may be on the Lower East Side. What we're going to try to get at, again, through the qualitative pursuit, is what contribution did St. Vincent's Hospital in its inpatient and outpatient health services make to the reality that we have a somewhat healthier community than other neighborhoods? And do we have to wait 10, 15 years to see a decline in the health of this neighborhood to prove it? Obviously, we don't want to do that. So we have to look at data that will allow us to draw inferences about the level of services that St. Vincent's provided that enabled the community to stay at this level of health, and to anticipate that without significant changes in the residents who live in this neighborhood, that we may see a decline.
In life?
So,
in survival?
So now, this next part of the this meeting is to hear from the community, their comments. What we're going to ask is that people line up. The mic is over there. Please keep your comments to 2 to 3 minutes. We'll be keeping time. Let's keep it respectful. Again, there's a lot of discussion to be had. So let's do it in a respectful way, please.
Hello, testing. Oh. Hello. Plug in.
We'll try this one.
Do I need a microphone?
No.
Okay.
But let's just try it once. It's another thing.
Is the bass on?
Yeah, screen. There we go. There we go.
Okay. Call me a bitch wouldn't be the first time, all right? But I'm finding it difficult to believe. I do have a master's degree in social from the Hunter School. I find it difficult to believe we're saying this was the hospital, was it 160 years, 140 years, and they don't have records of the people's, who they were treating, how, where, what, all these years. It was closed because they didn't manage money well, and apparently they were crooks. But they weren't closed because they didn't keep records or because they weren't treating sick people of all kinds. So that's the first thing I don't understand. Secondly, it sounds kind of like make work to me. I have worked for bureaucracies as well. And how much are y'all getting for your work? And I mean, I don't find it really constructive as to how many people are you going to ask where, and how, when are you going to ask me, her, him, Do we really need to have this study? It's been established. The hospital served 60,000 people just last year alone. Those are my questions.
Okay, thank you.
Do we have any answers?
Yes, well, I know that Dr. Cohen's being paid, I think, $0.
We're volunteering our time.
And we're volunteering our time.
And the last thing I say, just think about this, is that this is not just about healthcare for 2010. It's healthcare for 2020, 2030, 2040. This is an opportunity for us to look at where are the holes right now since St. Vincent's has closed. I don't think there's been a survey or any data collected since the closure of St. Vincent's. I mean, unless you can tell me of anything. So we're trying to find out where the holes are now and figure out how for the future we can prepare and plan for that. Now, I think we both can agree that that's a useful tool. Maybe you
How
don't
long
think
is it
so.
going to take? And we know we need a hospital.
Well, I think being at the bankruptcy cut, or you should be at the bankruptcy cut, because the judge has already said she has access to that information. So why aren't you there for getting that information from her? So your point is null. Right now, I find that the need for this data is unnecessary. I'm a man living with Crohn's disease. I go to Beth Israel now, and I can't get an appointment for 2 fucking months. Okay? I'm having attacks every 6 weeks where I bleed from my ass. Okay? I don't get anything done regarding my Crohn's disease, and as a result right now I'm going to have my colon removed in February. It's outrageous that St. Vincent's is not there, and you all have done nothing except waste time with this needs assessment. You have the information, and if you don't have the information, St. Vincent's had the information, and I don't know why you don't have access to that. It's make work. You were at PS 12. You had a plan. You talked to me privately about it, Long Island Jewish, and you said you had a plan to open a new hospital. You don't need any more work. Brad, you're the one who put the order in for the needs assessment. What was behind that? You want to run for mayor in 4 years. Okay? Hunter College, you only want to publish the results in a paper. This is not necessary to do the needs assessment. I'm not the only one that's sick. I'm not the only one that needs an emergency room. I'm not the only one that needs a 200 to 300 bed hospital. That's all this community has ever asked. They never asked for an 800 bed hospital. But I know that a young man on Morton Street was crossing the street with a white light and got hit by a car turning right off of the West Side Highway. He waited 30 minutes for an ambulance. He died on the way to Beth Israel. Brad told me at the last meeting I was at with Brad that he was going to start doing a needs assessment with Tom Duane. Tom Duane left the meeting. We don't have any politician who's doing shit to get us a new hospital. All they want to do is go to a meeting. And it's outrageous that you all waste the time here. I got news about this today, this afternoon. You didn't put up any notices in the community. If you cared about Chelsea, Greenwich Village, Soho, Chinatown, you would have put notices up, Community Ward 2 and 4, about this meeting tonight and got the community. We had 1,500 people show up at St. Vincent's Hospital a month ago. Hunter, you could have been there and got everybody to stand in line and they could have answered your survey. I can get, right now, I know, probably 700 people to show up at Hunter tomorrow if you want them to stand in line outside and ask them a question about whether they need a hospital. And I'll let you ask them 50 questions if you want to. But we don't need to waste time. You all don't need to make work to do this needs assessment. What we need is we need a hospital and we need people to do the right thing to get us a medical facility back in here. Nobody's done anything about the urgent care centers that are popping up, and this is my last point. But the urgent care centers are putting out brochures calling themselves emergency rooms. Emergency care center. Okay? That's bullshit. And you all have done nothing to stop that. Now, I've got my sense about me, but I have a neighbor who's in the first stages of dementia. She got the flyer, and she thinks she can go up here to 18th Street and get her emergency care now.
That's information that we need to know. So thank you for telling us that.
One is at a trauma center. In the last few years, on Salomon Ferry had 3 accidents on Salomon's side. What happens in one on the other side? Who they get the trauma people there? And also, this is about residents. This part of the island has a lot of tourists in it. How many people tourists we need emergency rooms? That's not the concern.
told by a representative from Christine Clinton's office that this needs assessment would take 3 to 4 months. Would you tell me how long it would take?
Jeff?
Well, I think we started in earnest in October. The expectation is we'll have a lot of the quantitative work that we did probably done by about February. And the piece that we don't know yet is the survey. It's a function of, I think, when we start the process and we finish it.
So that I would have to treat 3 to 4 months if you're okay.
Well, if you think
Give us
about
a
it,
date, please, for the end of the survey.
just going to be about that.
It'll be done.
Well, the expectation is, I can't say, I know part of that work will be done.
I'm saying all of the work.
We can't hear in the back.
I'm asking about all of the work that will be done.
The tentative timeline, the projection is somewhere 3 to 4 months, but it might be longer than that, that's the point.
Well, it sounds from the complex information, what you're gathering, and what you're going to do, it's going to take a lot more time. That's what I'm trying to say.
Well, he wants to get it right.
Why would you do something? I don't want to sit around
Should
waiting
have
for response.
all been done before the hospital. Before the hospital.
My question is, how do you intend to capture information concerning the healthcare needs of people who come into this area to work, to engage in tourism, to play, and yes, to go to the meat market and get drunk? There are a lot of people who don't live here. They come here from other parts of the city, other parts of the state, other states, and other countries. Yes, students.
We actually
All
talked
kinds
about
of
that.
people who are
Yeah.
not residents.
Dr. Cohen, did you have anything on that?
Encounter emergencies and need
Jeff has-
help
Yeah,
when
in
they're here.
fact, the emergency database that we have, by the way, the data that I just explained to you was not for people who were seen in the emergency room at St. Vincent's. That was for everybody who lives in the community wherever they were seen in New York State. So what we have is a database of all the residents that live in the communities that we're focusing on and where they go for all of their care. So if somebody is hospitalized, let's say from New Jersey or Long Island, we also know that as well, and we know when they were hospitalized in St. Vincent's or another hospital. The same database exists for those people that were seen in the emergency room and released. So and you asked actually a very good question. We could look at it from the reverse way, not from the community, but we can look at it from, okay, how are emergency rooms used in New York City or Lower Manhattan? Not only here, but at Israel, Roosevelt, and New York downtown. We can answer the question.
Yeah, and a related question. St. Vincent's on September 11 took on the character of being actually a strategic asset in its presence exactly where it is, where there's no other nearby facility of that kind. And in that sense, an important security consideration in the case of a man-made disaster like terrorism or, in fact, a natural disaster, given the geography and the transportation difficulties in New York City.
How's that going to be considered, Jeff?
Well, I think if you look at the broader role that hospitals play, and it's not only St. Vincent's, but all the, St. Vincent's was there because it was proximate to that disaster. And there's no denying that. There's no way to, explain that now. The issue is, the issue then comes up. How do, what role do hospitals play? I think we've gotten better as a city in responding, but I'm in no way, I can't address that. I think the role that it played was heroic.
But doesn't the assessment team feel that this public health function should be considered as part of the
Well, I think that's an issue that the steering committee, remember,
Exactly.
we're working on behalf of the committee. Absolutely, that is one of the critical arguments that have been put forth. about the need for a hospital on the Lower West Side of Manhattan. No question about it. People have addressed that in the steering committee, and I would be surprised if that wasn't expressed in the results itself. I agree with you.
Thank you.
Thanks very much.
Hi, thank you. Just to piggyback on what Margaret, the point she made, I think it's really good. I don't think it's a secret that there's, let's call it a resistance from the community for this needs assessment. And I am wanting very much, and I think the coalition has been trying to work as a community, and we really all need to come together. So I have a couple of points I just want to make, and then a couple of questions that I really hope can be helpful, because we do need to bridge the gap if we're going to get anywhere with all of this. First of all, the idea that the hospital, that there wasn't a needs assessment, or that didn't exist. The hospital wasn't closed because of a lack of need. In 2006, the Regional Advisory Committee report of the Berger Commission, which was chaired by Arthur Webb, stated that St. Vincent's Hospital was quote-unquote an essential facility. They also mentioned that there was a shortage of beds in the neighboring communities, and they predicted a population increase that would put further demand on the hospital. Again, in 2009, the strategic plan of St. Vincent's determined that, quote, approximately 360 to 396 inpatient beds and behavioral health emergency observation beds are necessary to meet the community need. It actually went on to say that St. Vincent's regularly undertakes assessments of healthcare needs. In addition, there was an assessment that needs assessment that was submitted in the current certificate of operation for St. Vincent's as recently as May of 2009, and literally in an application to expand the hospital services as even more recently as November of just this last year, 2009. So I think the concern, it's not about the needs assessment. Needs assessments happen regularly, that's not the issue. The issue is, as I look at this map with the different colors of green, and I think the concern from us is that we're not specifically hearing that this needs assessment is to restore services at the St. Vincent's Hospital facility. And our concern, our fear, is that this is for some integrated into some sort of mega real estate development deal sometime in the future for the Hudson Yards or somewhere else. So maybe what could be very helpful is if you guys could make clear that there's a commitment to immediately restore services at the site of St. Vincent's. And frankly, I think that that would make all of us a lot more comfortable if you guys could explain that. But how do I follow this plan?
Well, just, if you could just ask the second question, then
well, can you answer that question? Is there a commitment?
Yeah, well, Community Board 2, I mean, when you say the community is not fair of needs assessment, Community Board 2 does represent the community and unanimously supported the needs assessment. So, I mean, I understand that some people may disagree, but when you say community, you should use it in terms of understanding that people might disagree with you. So, Community Board 2 strongly supported the goal of a needs assessment.
As well as CB4.
Well, but time out 1 second, Red. How many people here are here from the community? Raise your hands.
Isn't everyone here from the community?
I don't know. Some people may live in Queens or.
If you just let me finish my response.
Okay.
The second part of it is that Community Board 2's goal has been unwavering that we would like hospital uses, a full service, urgent care facility restored on the current St. Vincent's site, and that's in our resolution of June of this year. So, and that's going to
I think that's very positive. Let me make sure, because words are the source of misunderstanding. So this needs assessment, because we don't know what the stated goals of the needs assessment are. We don't know where this goes, who's it's presented to. When we look at all these other needs assessments, and we see
just like who's we that you're talking about?
the 5,000 people in the Coalition for a New Village Hospital, the people who routinely are asking questions, the people who are up here speaking, person after person after person, a large portion of the community. We are concerned that there isn't a stated purpose for the needs assessment. And I think, and I come here in service, I thank you guys all. Jeff, I hear great things about the work that you're doing as I listen to the work that you're doing in terms of thinking about the needs assessment. I hear diversity, I hear in-depth conversations about young and old and different ways of being, and that's wonderful for a needs assessment. It's not, you don't have an issue, it's not an issue with the needs assessment. I think the way that you can get the community more galvanized and more invested in what's going on is to let us know what the plan is and to reassure us that there is a stated objective to see if we can restore services.
Well, I can only speak for CB2, and our goal all along has been we want to make the case for a full service hospital, and we think you need the data to make it. So I'll say it again, we think that you need the data to make the case for a full service hospital.
Beyond that, it's the steering committee. At the end of the day, it's just an advisory group. At the end of the day, when this is all done, we're going to make recommendations and use those recommendations to advocate for a hospital. We have no power over what happens to that site. All we can do is make recommendations. This is what we're doing with the help of these two gentlemen and the organizations that they're with, is compile data so that we can make informed decisions and informed recommendations.
I'm telling you on behalf of the, I'm trying to say to you,
but
the
the
way
behalf of the
that we're
community
going
is
to
misleading.
get
It's
the
misleading
community
because I'm part of the community
in this is to say whether or not this steering committee, this needs assessment is committed to finding a way to restore services at the site of St. Vincent's. And if it's not, it's not. And if it is, it is. But I think we deserve an answer to that. And that's what we're wanting. I hear you saying that you want a full-service hospital. We all want a full-service hospital. But do we want a full-service hospital in 10 years somewhere else? Or do we want a full-service hospital immediately at the St. Vincent's?
I want one right now, but there's some very real practical things that you're not dealing with, that you're not addressing. We need to fund it. How are we going to fund it, Yetta? We need to be able to present the case to
I'm happy to answer that. Is that the issue? Because I'm talking about what the stated goals are for the needs assessment. How we fund it is we get the New York State dormitory authorities to give us a loan and we bring a sponsor forward. A loan from the New York State Dormitories Authority would bring millions of dollars into New York State. The sooner we get a hospital back at the site of St. Vincent's, we create thousands of jobs, we create revenues into the city and the state, we bring federal revenue streams in. But that's not the issue today. What we're talking about today is simply this needs assessment. And we want to be with you. We want to work with you. But we just need basic, simple answers. And I'm just saying today, a suggestion, a recommendation to you guys, and we're here, available at your service to work and to support you, is to say...
Thank you very much. We appreciate that. We appreciate that.
Really?
Yes. And we're trying to disseminate the facts, but quite honestly, this is a misleading document.
How is it misleading?
Because you're saying that the needs assessment is, you're saying the ultimate goal is not a needs assessment, it's a hospital. We both have that goal.
What?
We both have that goal. We both want a hospital. And this is misleading.
What is misleading?
The ultimate goal is not a needs assessment, it is a hospital. We must all work together to make this happen. We want to do that.
Why are you writing this down? And how is that misleading?
Because why are you implying that we're not? Why are you implying that we're not contrary to that?
I'm not implying that we're not. You're saying the ultimate goal is not a needs assessment, it is a hospital, is misleading?
Yeah, we want a hospital. You want a hospital. We can't commit to you that we're going to, at the end of this, put a hospital in St. Vincent's because we don't have the authority to do that.
I've got to tell you, one of the problems we have is we haven't had a dialogue.
Thank you very much.
Thank you very much.
Block Association, very involved with the Kitchener Hospital, and I've been involved with seniors and caregivers for many years now.
Is the mic working? I can't hear.
Oh, is that better?
No.
Yeah. Speaking to the mic or hold it? Hold it. Okay. Elizabeth Adams, 12th Street Block Association. I've been very involved with seniors and caregivers, which is a very serious issue. I've also worked for an organization that worked with caregivers to help relieve their stress and deal with the issue, all in south of 34th Street and 59th Street, all the way down to the end of the island. So I'm very involved and very aware of the issues of seniors and the health and stress level of caregivers. I'm also, as I said, on the 12th Street Block Association, and I live in a 22-unit building. 12 people in the building are over 80. We even have one who's 101 next week. And there are now 4 children, small children in the building. These are all people who are going to need, and that's just my small building on 12th Street. We have a lot of seniors. We have an aging population. It's basically a norm, a naturally occurring aging community. So we have to think about the aging population. And I'm also alive to speak to you today because I had a heart attack and ended up in St. Vincent's 4.5 years ago. If it happened today, I wouldn't make it. So I'm very scared about this issue. And anything I can do to help you, to help identify people in the building, in the neighborhood, found me, I'll be glad to get you to the right resources for the senior population. So,
thank you very much.
I think that you're going to get a great deal of cooperation from a great number of people once you make very, very clear and don't leave it ambiguous about what you are supporting and what you are not. I was under the impression that the community board passed a resolution to put a landlock on that site for a hospital. Now I am hearing you repeatedly saying, Brad, that you are committed to a needs assessment study. Why wasn't that needs assessment done before the hospital was closed? And if your needs assessment is based on a survey that's going to be conducted by CUNY, I would like the man from CUNY to stand up and give me a definite date, a month, when this will be complete and submitted. Nothing else is good enough. You cannot stand here in front of the press and say you don't have an answer for us yet. We want an answer for that, and we want it tonight.
Well, I can tell you that the interviews and the focus groups are planned to be done in January and February. I expect those will be completed by the end of February, and our results will be tallied in March and able to form a report that complements what North Shore Long Island Jewish will be doing, and we'll put them together. Community survey is something that we're providing technical assistance on. There are a number of groups involved. We don't have ownership of that, per se. We're eager to get started, to work on it. It's already started. Judy Wessler has provided a number of questions. Other people have provided questions. We think we can put our heads together on that, and by some point in January have something we can distribute widely.
And as for the question directed at me,
yes.
CB2 passed a resolution in support of a needs assessment, I think back in June.
And February, as the new statement is closing, that was also part of our resolution, that we wanted a needs assessment for the hospital. So we've been doing this a long time.
And then in addition to that, we've along the way been supporting St. Vincent's plans for a new hospital with modifications back in the day. And more recently, as you mentioned, we supported a resolution that we wanted hospital uses to remain at the current St. Vincent's campus site.
Full service hospital uses.
Yes.
Okay.
So why
did you have a meeting at which you very sarcastically dealt with people that have been nurses in this community? A gentleman who has spent his whole career dealing with AIDS patients in this neighborhood, when nobody was willing to simply accept what you had, all these people sitting up there proposing to us, which were urgent care centers. And we were supposed to just accept that and move on and go home.
I'm sorry, that wasn't our intention. You
gave a very strong impression that that's what you wanted, and you treated some people that have devoted their lives to health care in this community with great disrespect.
Well, that was not that. For that, I apologize if I was responsible for that.
I'm from the community, so I guess I'm part of the week. First, I want to thank all of you for your time this evening. You're also spending time working on this, and coming to spend time here. I think part of the week, we're incredibly fortunate to have yourselves and the effort that you're putting into this. I think there are communities elsewhere who would be desperate to get people such as yourselves to work on this issue. Personally, as far as needs assessment, I like to approach it with an open mind. And that sort of goes to where my question is. Because I read something in the Villager, it's got me scratching my head. This was last month. And the Villager has a lot of very good sources, and pretty credible. It introduced, it said the focus is now on a healthcare needs assessment. At the end of the paragraph, it says, what we're hearing, however, is that it's unlikely the assessment will recommend a hospital. So my question is it possible for anybody to actually know what the outcome of this assessment is before it's done? Can you comment on that? Is that a credible statement that somebody could know what the recommendation is now, even before the work is done? Do you find that to be a credible assertion by the editorial?
I think that is, really unfair speculation, and probably somebody with an agenda has planted that story with the reporter, and that's where that you see that all the time in local, national politics. So I personally don't think that has any credibility.
I mean, until we see the data, we can't make recommendations. Part of that data hasn't even been, the process of compiling hasn't even started yet. So I don't see how we can make any conclusions until that even happens. So, again, I'm interested in who that source was. Thank you.
Hello, my name is Corey Johnson. I am on Community Board 4. I live at West 15th Street and 7th Avenue, just a few blocks from St. Vincent's site. I've used St. Vincent's many times, and I want to thank the four of you and the many other people on Community Board 2 who I know. Joe and other folks have been working on this for a very long time, in a very committed way, in a very substantive way. So I want to thank you guys all tonight for coming up and having multiple meetings with the public and with the community. I just want to make a brief comment, and then I have a question. The comment is, I find it heartening in many ways that the closure of St. Vincent's has ignited community grassroots activism in a big way, and I think activated the community in a big way, that we've seen people turn out on multiple occasions at rallies and meetings, and I think that has been heartening. What I find very disheartening is the real adversarial, accusatory nature that continues to exist and persist with regard to, I feel like, conspiracy theories being afloat at every opportunity. And, I think there's great and deep disappointment with the process of what occurred in St. Vincent's closing, and in people feeling like a neighborhood and New York City institution has been ripped away from them with probably not a well thought out plan. But I find it really disheartening that, volunteers on behalf of the community, 50 on each community board that do not get paid for their time, continue to volunteer with people that continue to volunteer in this needs assessment survey, and I think our representatives from our elected officials' offices that continue to show up, meeting after meeting. I just find the whole civility of the debate very disappointing, and I would hope that we can all agree that the best thing that the community could do is work together, without accusations and the inflection of this really poisonous discourse to continue, because I don't think anything gets done that way. So that's the statement part of it. The question part of it is, I don't know of, I previously was a co-chair of the land use committee for CB4. I don't know of a land use term called landlocking the site. I know that, you can make a recommendation to say that you do not wish the Department of City Planning to initiate the process to rezone a site, and city planning typically doesn't rezone sites unless the administration or the local community board asks for a rezoning to occur. But my question to you, Brad, is there any process underway that anyone has asked that site to be rezoned? Because I don't see that site being rezoned unless the community initiates that, or the elected officials initiate it, or the administration initiates that, and I wanted to sort of ask about that.
I would say not that I know of, and I think not that Joe Hamilton can back up, not that we know of. We know that, you know, what's been reported in the press and Community Board 2 has not been part of any conversations with the Rudin organization and the bankruptcy court or the trustees of St. Vincent's. But, you know, it's possible that, you know, discussions have occurred. According to some press reports, they have. But we're not part of those. We're going to be part of the public review process if and when there is a request for a rezoning, but we're not part of any deal making with the bankruptcy court.
And just to follow, that resolution that the community board passed with regard to the St. Vincent site said that the community board supported continued use of a hospital on that site.
Yes, correct.
Thank you.
Thanks.
Good evening, my name is Miguel Acevedo. I'm also a member of the steering committee. I was the one who first questioned, should we have a need assessment, because I felt that we already had one with the Borough Commission. As being a member, I have learned a lot that we do need a needs assessment, because there was a percentage on the map that was there that perceived 17% of the low-income residents that reside here in Fulton Houses in this development and that in Chelsea were underserved. So I would have never realized that 17% as a number may be a low percentage, but believe me, I know for a fact there's many residents that because of the closure of St. Vincent's Hospital are not seeing doctors today. This past summer, we lost 6 seniors that may have been alive today because the closure of St. Vincent's Hospital. Not to blame the hospital, but they probably had nurses and doctors regular visits, visited them. Once the closure happened, they're no longer here with us today. So, but the needs assessment is important for us to be part of because we're educating the community and ourselves on ways to really bring a hospital back. And my understanding as towards the coalition that Yetta is speaking about, members from that coalition are part of the steering committee. So I guess in fairness to the needs assessment, they're being part of it. So it makes it fair for the whole community to say that the coalition is not being left out because you have 4, maybe 5 members of the coalition that are part of it, and hopefully they're bringing back the information to the coalition to educate you guys to make sure you're part of what's going on. No, I'm not saying, I just want to make sure that I see a due, fair process going on.
Good evening, everybody. I'm Yvette Stark. I live on West 11th Street. I'm a member of the Coalition to Save the West Village Hospital. Thank you very much for your time and energies. It's very appreciated by myself. I'm sure by everybody in the community. You know, I've been asking the same question over and over again. I know that this assessment is being done, but I asked this months and months and months ago when the Rudins had proposed their big development site. All of a sudden, you know, we were getting this new hospital, which of course nobody wanted, a 40-story building in the middle of the West Village. So it all got protested and it all got disbanded, and we're in this mess today. But the bottom line is, we didn't need an assessment when Mr. Rudin was coming in on his white horse, and he's a very lovely developer and has done great things in New York, but we didn't need this assessment. What we do need is an emergency care hospital. That's what we need. And being involved in the real estate industry, it's very difficult to recreate that infrastructure. The infrastructure is there. The electrical lines are there, the water lines are there. Nothing needs to be blasted 3 stories down in another neighborhood or community. It's all there. And it's really important, just for me as a resident who's used the hospital for many years, watch people live and die there. The spirits are still walking around the neighborhood. It's a little depressing walking around the streets of the hospital still. You still feel the energy, the negative energy that's there. And you know, that's, I think, what the issue is here. The issue is here that we have infrastructure, we have a building, it is made to be a hospital. It was created in a neighborhood where there was not a lot of development at one time 160 years ago. And that's where everything was built up around that hospital. So aren't we lucky on the west side to have that in the location that it's at? if there is a way to protect that, bankruptcy court or not, because we don't know if St. Vincent's was really closed illegally or not. That has not been surmised yet by the courts. I personally believe it has been closed illegally, and I don't think the bankruptcy court should be releasing or selling that under the G. You know, I think it should be protected, and I think that as citizens we have to demand that that be protected for ourselves and our children and the next generations in the village, and for your kids, and for your aunts and uncles, and people who are visiting here from all over the world. There are people who are visiting here who will get sick on the west side. Where will they go? Where will children go who hit their heads, you know, in Chelsea Piers and on Pier 40 and rollerblading? People get injured on the west side. There was just a Quidditch, big Quidditch tournament on 11th and 51st Street. I was there. My friend's daughter was competing for Lafayette. And I'll have to tell you, I went all the way uptown to 113th Street and Amsterdam Avenue to Roosevelt because there was a head injury from a broom and the kid needed like 6 stitches, but it really looked worse than that. I have to tell you, I thought his whole head was torn off initially. And, you know, from 51st Street on the west side, I went all the way uptown, waited for 5 hours. There were no plastic surgeons available, by the way, on a Sunday. And it was just a nightmare. That did not happen to me when I was a resident in the West Village. There was attention. You had to wait. You were told you had to wait. Nobody knew why I was waiting for 4 hours and playing mom to a 20-year-old who I didn't know. He was a Quidditch player. But I just want to share that we really need to keep the hospital a hospital, an emergency care hospital. Not urgent care, which is a doctor's office 24 hours. That's really what it is. I mean, and we need it not just for our community and ourselves, but for now all these Ivy League schools who came here from all over the United States. And if my kid goes to Hawaii, they'll come from Hawaii. But, you know, to come and play Quidditch for 2 days, and there were 40 injuries in a day and a half. I was at the hospital the other half day. I don't know how many more happened. That was just one small group of kids that came here on the west side. So for me as a parent, as a resident, as an activist, somebody you see a lot, I really want to say that we need to keep that infrastructure a hospital, an emergency care hospital, and a pediatric care hospital, and also get all the money back that we deserve in our community from the federal government, from the state. There's a lot of money that was put in this community, you know, because it's a full-service hospital. So this needs assessment didn't need to be done when Rudin was building a hospital, because he was getting $5 million worth of real estate to put in his pocket.
I appreciate your activism, and I think, again, I want to emphasize, we're collecting this data to make a case for, I think, the same goal as you want for a hospital.
Right.
I think, in the end, we can find a way to work together, help us make that case, help us collect that data.
Well, whatever you need, I'm there.
There we go. That's
whatever you need.
Keep us honest. Make sure that we're doing this the right way.
Are you all there? Are you all there to help out?
The more help, there you go. That's a make it
Stay off of those kids, Chef Deal.
I just wanted to respond to Brad. Said there might have been somebody with an agenda that planted something in the villager, with the villager, Lincoln Anderson. And regarding the health needs, saying the health needs assessment wouldn't result in a hospital, I think we were just basing that on what we were hearing from the state commissioner, how he let St. Vincent's close, the absorption study in the closing of St. Vincent's, which I was told by a health insider, maybe they did have an agenda, that this absorption study made a good case for how everything was absorbed, and thus maybe it would be inferring that it would be hard to get a hospital when you've got those forces saying, look, you absorbed everything. But we did not specifically have anybody tell us.
And Doctor, I'm sorry you got mixed up in this ping pong ball, political ping pong ball that's been going on since probably November of last year, okay? Because I got mixed up in it too. I'm a registered nurse, I take care of sick people. The nurses at St. Vincent's were out in the street in February of last year. We called Community Board 2, Joe Hamilton, to be out in the street with us. She didn't answer, she didn't come. The doctors, Joe, I'm sorry, you sat there and said that the assessment was asked for by the community board too before the hospital closed. I'm sorry, that's a misrepresentation of the truth because the nurses were calling for it. And it never got done. We said the Burger Commission was there. Why wasn't the state looking at what the Burger Commission said about that hospital? Nothing was done about it. So that's totally misrepresentation of the truth. The doctors had a press conference and asked Joe Hamilton to be there. She didn't show up.
I mean, how are we looking forward? Yeah.
Okay, okay, that's a typical political answer. Let's look forward. But let's look at the history of what's gone on, because Jeff and the doctor shouldn't be putting up with what the political problems are in this room. And if you thought there should have been an assessment, why wasn't it done before the hospital closed? Why didn't the political people in this room and their representatives get Dr. Dane not to close that hospital so we wouldn't even be here tonight? That's the question you better not forget in this room, because you need to put pressure on the new incoming Department of Health Commissioner. You need to put pressure on the new governor, because what's gone in the past, yes, we have to put that in the past. We have to put that whole administration in the past. And yeah, we have to move forward, okay? But another thing I'm really sick of with the politics in this room is every time the coalition, which is close to 5,000 people, I am a member of it, and I do sit on this assessment committee. I sit on the assessment committee as a representative of the New York State Nurses Association. Not because I totally agree with the assessment committee, because I've looked at the Burger Commission papers, and we could go on and on about that, okay? But what really has to happen in this room is this side of the room has got to come together with that side of the room to make a hospital for sick people. And why am I so passionate about it? Because I love this community. I've taken care of you for 25 years, okay? And to jump on North Shore LIJ, who knows how to run the business. They've shown that. They make money because they know how to charge, they know how to collect. The hospital I worked for did not know how to do that. We told them year and year. The nurses know because we talk to people. The nurses know because we get sick and use the emergency room. You would get sick and go and have a procedure done, you wouldn't receive a bill for 6 months. Okay, so don't jump on the back of North Shore LIJ or the doctor that's sitting down at the end of the table. They're doing what they've been asked to do. But put the pressure on the political people that are in this room to do what's right for your community. Thank you.
Yeah.
You can always count on me to tell it straight, so thanks very much.
I want this place to get it straight. I don't get it straight.
A very nice way to end this evening. You get the information that was discussed by Jeff on the CB2 website, cb2manhattan.org. You'll also find updates in terms of our next public meeting and further information that will become available. Thank you very much.
Just a question helping these assessments. I had planned if you were in public places and there were dates, and we came and stood in line and gave it.
Just one more
Okay. All right, fine.
The steering committee and CB2 and CB4. You know, do you want a full-blown hospital on the former site of St. Vincent? Do you all want that?
Yes, please. CB2 does.
The CB4 want it?
Yeah, we wrote a resolution saying that we support that.
All right, and the next question is, has the former site of St. Vincent's Hospital been sold?
No.
That's a question for neighbors.
Yeah, thank you, Mr. Not yet. Thank you. Thanks very
I live in Bayshore.
I live in Bayville.
Oh, yeah?
I grew up in Val Street.
Okay, where are you working at?
Right.
I don't think that the bankruptcy court should be able to sell those properties unless we know that it was closed legally or illegally. That's my feeling. And if that is done, that is criminal. And I understand the creditors are G Capital, and I'll call G Capital.
I don't understand why the hospital closes down so that they can pay off the bankruptcy to the investors, and the bankruptcy money comes from the community. So they're taking the hospital and we're having to pay for it.
Right.
For their mismanagement. That's our money as taxpayers.
And I want to know who has a BMW and a Rolls and who's vacationing in the Bahamas this winter.
All this bailout.
But beyond that, I want my hospital first.
What happens next?
Well, there was a joint meeting between Community Board 2 and Community Board 4 to give us an update on the needs assessment, and so we asked community members to come out in good faith and to listen to what they had to say.
And you're optimistic after a meeting like this, or?
Well, I you know, it was, I guess it was disappointing that we didn't get some of the answers to questions. I think there were some very good questions raised by people in the community. What I wanted to know was what the commitment was, or what the stated goals were for this needs assessment. Because, you know, as I listened to it, as I said when I spoke, I think that the way that they're doing the needs assessment is excellent. I think their thoughtfulness about different communities and sub-communities and groups within the neighborhoods that are being served is excellent. The issue is not about the needs assessment. The issue is what the needs assessment is being used for, what the stated goals of the needs assessment are, and if there's a commitment on behalf of the steering committee of this needs assessment to work to restore the services at the site of St. Vincent's. Our fear, or the community's fear, the coalition's fear, is that this needs assessment will only be used as a tool to put off some future mega hospital built somewhere else sometime in the future, rather than working to immediately restore the services.
Now, for the past couple of meetings, you've been asking for closer collaboration with the community boards. Any progress?
Well, I mean, we're going to keep showing up and asking. We're going to let them know that we're here to work with them. There certainly seems to be a kind of reaction from the community boards, or a kind of a little bit of antagonism. So we're going to just keep showing up and tell them we want to work with them. The only way we work is if we all work together. The only way we get a solution to this problem is if we all work together. We're just going to keep showing up and giving them that message, and eventually, hopefully, they hear us.
So this past week there was information, or there was news that the main building is up for sale.
Right.
So what does that mean?
The buildings are being sold. I see this as an opportunity for us to come forward to work with our government and the public officials to get a sponsor like Long Island Jewish Hospital or some other sponsor, Mount Sinai, to come forward. And this is a great opportunity. You know, when you buy properties, distressed properties like the St. Vincent site from bankruptcy, you're going to be getting, you know, 60 cents to the dollar, some sort of deal. So this could be an opportunity for us to actually bring a new hospital back to that site.
And does landmark status figure in any of this?
That's an interesting question. You know, somebody was talking about the idea of landmarking the cathedral within St. Vincent's Hospital. The bigger issue is the zoning, and you heard some people talking about the resolutions that were passed in Community Board 2. One of the resolutions was to say that this property couldn't be changed in terms of zoning for to commercial use or to residential use. The fear that we have is that, in fact, the powerful real estate interests will want to use this land for luxury condominium developments, commercial development, something other than the types of community uses that it's currently zoned for. That's what you hear people talking about, the land lock. There's a resolution that was passed to lock the use, the zoning use, so that it's only for community use.
So what are the next steps on your agenda?
Sure. On January 20th, we're going to have a community forum. It's an opportunity for us, the community, to let our newly elected officials in Albany know what we're doing and what our needs are for healthcare in Lower Manhattan, and to hopefully work with them. It's going to be a new Department of Health Commissioner. There's going to be a new governor, and we're hopeful, we're cautiously optimistic that these folks will be able to hear what we have to say and to work with us to try to get us a hospital back at the St. Vincent site.